Welcome to Development Desk, a space where parenting meets psychology, advocacy meets action, and insight replaces the noise. I'm Anna, a school psychologist and mom, sharing what I've learned from years inside the system and alongside families. Together, we'll unpack the why behind the behavior, decode the school processes, and build something strong, one conversation at a time. From insight to action, from chaos to clarity, this is Development Desk. The information shared on Development Desk is for educational and informational purposes only. While I am a licensed school psychologist, this podcast does not constitute psychological services, legal advice, or therapeutic relationship. The views expressed are my own and do not reflect the policies or positions of any school district or employer. This content is not a substitute for professional consultation with a qualified provider in your state. Always seek appropriate support when making decisions related to your child's education, health, or legal rights. Very dear friend, Verenice, Dr. Verenice D. Santiago Eastman. It's a very long name.
It is.
So we know each other from work. As she was transitioning out of a campus, her last 2 weeks, it was my first 2 weeks coming in. Mm-hmm. And so that's how we met. And then we just clicked and we've stayed in contact since then. That was a while ago.
That was 6-7 years ago.
What?
Because we met when our daughters were barely born.
Right.
They weren't even here yet.
Yeah, so our kids are the same age. So that also makes it easy to hang out. Yes. As most of you moms know, it's easier to have mom friends when we're the same age.
Yes.
Yeah, so that's right. I totally forgot about that. And our little girls did not like each other for the longest time.
No,
So
it took
funny.
like 3 years.
Yeah, 3. You guys are gonna be friends because we like each other.
And now they ask me, are they coming? Are they coming? Are they coming?
Yeah,
That's the way I motivate them to get going.
yeah. You get to see the girls later. Come on, guys. Yes. So we just hit it off. We had a lot of things in common. So I'm so blessed to have you in our lives. She helps me babysit the kids too. So actually that's an episode that just recently came out, is community. And Verenice is definitely part of that community. And I've talked about some of your recommendations and advice that she's given me with my own kids. And so I thought that it would be so beneficial to have her on for other parents. I know I get a lot of questions from parents, and I feel like a lot of your input would be helpful.
And same girl, same here.
So background is she is a licensed psychologist. She's also a school psychologist. Right now she is in private practice. So you left the school setting for multiple reasons. But you are in private practice working with preteens, adolescents, navigating anxiety, depression, and then also working towards independence away from mom and dad. So
Yes. I do that with my young adults.
Yes. So college age students.
Yes.
Okay. Yeah. And so you have expertise in psychological evaluations, motivational interviewing, collaborative working with families and local organizations, and just really committed in helping kids in general. Again, I feel like even with your friends, like you're a great support to have and just like bouncing ideas off and just being, I feel like you do a great job at equipping parents. And I think that's also part of your practice with some of your clients is like the parent training piece of it. And that's what we talk about a lot. Like I know I share on the podcast a lot is that when you're taking your kid to therapy, you really know when you have a good therapist or psychologist for your kid when they're taking 50% of the time with you, because parents are there to help generalize the behavior. And a lot of it, which we had this conversation a few weeks ago, is, a lot of it is us parents are enabling some of these behaviors and we don't even know it or we don't see it.
Right.
And being able to get that outside perspective is really important. So I appreciate that you give that parent training. I think it's really important part of therapy for kids. I'd hear, I know we're kind of getting off on a little tangent here, but I hear so many parents that will tell me, my kid's therapy is just not working. It's just not helping them. Their behaviors are the same. And my question is, has the therapist or psychologist taken you out to talk to you about maybe something that you can implement in the home?
And more times than not, it's no, the therapist doesn't talk to me. It's my kid's therapy. But really the parent is a big part of that. Okay, so let's just start out with you telling us kind of about your path in working with families and children and like why you were even interested in the field and your background, passions.
I will boil that down to like 30 seconds.
Okay.
I always like to say that I was born to be a psychologist. I remember my very first kind of tiptoeing into the waters was when I was in 7th grade, and I became a peer counselor. And that was a very fun adventure, and I took it very seriously. I was there with friends, and I remember when
it was an actual title?
It was.
Oh.
It was like a program where you were welcomed in. There was like a few of us. You were trained in listening, and you were trained in providing like peer mediation. So if you needed someone to talk to, like a friend, because you didn't have many or you didn't feel comfortable, they'd bring you in. And then if there was like a conflict between two peers, like you and someone else would go in and try to help them resolve the conflict.
What a neat concept.
Yeah, that was 7th grade. So I like to say like I was born to be a psychologist. I think that's kind of my nature. Although sometimes, I mean, I've got to make sure I'm not playing that role in every aspect of my life. But I like to say that that's how I kind of got started. I was interested in development originally because my university experience started right after Hurricane Katrina hit, and I was at Loyola University. And so I was able to see the impact of...
Which is in New Orleans.
Right. Natural disaster and the effect that it had on their families. I worked at a daycare, and so I was able to have that opportunity to notice the functioning within a family, post-traumatic stress, and all of those. And that's kind of what equipped me and motivated me to go into school psychology, which is something that I'm not in the schools right now, but originally, and still I'm very passionate about, is that how do we reach all kids? And one of the ways to reach all kids is through the school system. And so that's what kind of propelled me into the school system. And then now I am in private practice, but every time I step away, like into a school, there is this just like of energy, you know, because I am a product of the school system. Like I wouldn't have a PhD to date if it wasn't for public schooling, and if it wasn't for teachers that were in the public schools motivating me to reach my potential. So there's a very tight connection that I want to give back to the school system at this point.
I love that. And why? And so now, why anxiety and depression? So that's, I feel like, a lot of your focus right now with.
I think when I started, I had a lot of experiences prior to having my own private practice that were working with a lot of children who come from traumatic experiences. And that was when I began my family, was a little heavy for me. And so then I decided to go into a different route where I was going to be working with families and working within the emotional system that they kind of create for their house. And I think that kind of naturally came as I became a parent. So it wasn't that I necessarily chose it, but it was kind of a way there was a lot of opportunities available for me to do the work that I love. And so then I kind of started to do a lot of like the therapies that we used to call exposure therapy. I think that's what most people are familiar with. And I really enjoyed it and I loved it because not only did I get to like stay in my office, but then I also got to go outside of the office and get a feel of working with other professionals in the community. And so I think that's where I kind of decided that I was going to start, and now it's kind of become my niche.
Okay, I like that. So anxiety is such a big topic with everyone. I feel like everyone uses anxiety. And even the new book that came out, The Anxious Generation. I love that author. And so it's such it's just such a popular word right now, anxiety.
It is.
And I think I want to focus a little bit more on that because it's just so popular right now. Like you scroll through, or I don't know, maybe it's my algorithm, the things that I'm looking at, but I feel like everyone says I have anxiety or this made me anxious or so what like how does that show up differently for children? What is this is a normal behavior, right? Normal. And what is as a parent maybe I should look into something more because that's kind of like my own journey with Mason as I've been like sharing on the podcast of like when do we say okay, I've done all of I could like this is not normal anymore. So how does that show up for kids and at different ages?
And I think that that's a question that's going to have a lot of very different answers. And what it really for me boils down to, and I encourage parents to ask themselves, is how much of this anxiety, of the level and intensity of anxiety that they're experiencing, is it affecting them in their development and in their future, and then affecting the family? So we can read books and we can try strategies, and I definitely recommend all of those in moving together in pursuing kind of like a journey, right? Or a process of how are we going to manage this within our family. But then there comes a point where you kind of feel like there's a little bit more, right? And like, I can't really describe it. It's almost like a gut feeling. And I think parents tend to feel that gut feeling like, okay, this is not going in the way that I want to. We're at a crossroad here and I'm not really sure in what direction to go.
Right.
And it doesn't always.
So going back to that, when it's affecting their development or affecting the family dynamics or affecting their future.
Correct.
Okay.
Yes. And I think when any one or all three of those are being affected, then you might want to look into some professional help. And I always recommend just a consult at first because it's really nice to be able to just share with therapists that you have in mind, like what your ideas are. Right? Like, what do you perceive the future to be? What are your resources? How can you make this happen? Because it doesn't always have to mean that your child is in therapy. It could just mean that you're receiving some support on the side, trying to help your child. And, you referenced that earlier, is that we are the most equipped as parents to help our own child because we're in their lives day in and day out. But we don't have the knowledge all the time and the access to, or even the time. To be able to say, this is what's going to fit well for my family. And I think that's when professional help can come in to go through and decipher what would be the best path for your family.
I think that's a great point. Just even finding a good child psychologist or therapist, counselor, going in and just talking it out with them first.
Right.
The consultation piece of it. And again, I don't feel like that's a standard practice with a lot of child therapists or psychologists from what I'm hearing. Like when I talk with families at schools and I talk about their process and, that wasn't asked of me, that wasn't brought up. I think that that's an important piece before deciding if ongoing therapy is going to fit. But like you said, maybe it's just like, I'm so much in the situation, I didn't see that part of it. And a professional can maybe highlight that and say, let's work on this first, and then let's come back.
Right.
But again, that had nothing to do with, let me play with your kid on the floor for an hour and then not have a conversation with mom and dad. So I think that's a really good first step.
Right. I think that's a good point. All psychologists have a different type of training. And each family is very different. So there are times where I do need to meet with, in Texas, we don't practice this, but in other states, counselors at school have the ability to meet with kids. And they meet with those kids without parent consent for up to 3 sessions before they have to obtain it.
Oh, in the schools?
Right.
Okay, yeah.
And Texas is not one that ascribes to that. But and I think that's necessary sometimes because there's not a good connection between the parent and the child.
Yeah, I
and
can
so
see that.
there may be some gearing up to. And then, yes, different type of training.
Yeah.
And the different type of approach.
It's almost like saying, like, there's always two sides of a story. There's always two parts to a story, right? And so it's like you're getting another story when you're seeing the student.
Yes.
Or like getting their perspective or like trying to understand their personality. And
Right.
Okay.
Right. Right.
Okay.
There is some time that, you want them to be able to build rapport. And maybe it's someone that does not really feel like they want to be vulnerable with parents yet. It's just going to take a little bit before we build that. Ultimately, everyone's different. But and I addressed this at the beginning, for me, family is very important. And so our goal is, even as we discuss confidentiality, and the limits of confidentiality, as we do that, my goal is to bridge communication. So the most anecdotally for me and my own experience, clinical experience, is like at the end when I terminate or when we decide to terminate a counseling relationship, what has happened is that my relationship with the adolescent that I'm working with has now shifted to a strong relationship between mom and daughter or son and father, or vice versa. And so now it's like they don't need to talk it out with me anymore. They can talk it out with their parents. But it doesn't always start off that way. And so I think that at the beginning, at our discretion, we may have, and we may feel like maybe meeting with a parent would not build rapport with this child because of these factors.
Right.
And so we have to start there. But I sure hope that we're, as a professional, like we are communicating that with parents. Like this is our eventual goal. We just need to follow these little steps until we can kind of get to this goal where they are comfortable sharing.
Right.
And so sometimes it does help not to like talk with the parent during that session, but like a week later via Zoom or on a phone call and talk about,
so they don't, and probably so the child also feels like there's some type of confidentiality, like, oh, everything I just talked to you about, you're going to go tell my mom. And
yes, they always feel that way. Yeah. Which makes sense because technically, I mean, parents have the right to a dialogue, to know all the dialogue that occurs.
Right.
Technically. And legally.
Yeah.
But it's not always helpful.
Right. Oh, that's a good point.
You want to know everything.
I struggle with that.
I know. No, and I think it depends on age too.
Yeah.
Right.
Yeah. I shared when Jessica and I did an episode on anxiety, and I shared my experience. I don't know if you heard about it.
Probably.
Or you heard that. You heard that episode. Oh, okay. Well, this one was a while ago. It was like one of the first few ones that we put out. But Verenice recommended the psychologist that our family works with, and I was like, this lady doesn't know anything. Like, she's not telling me what they discussed, and she's telling me I should be doing this and that, and she doesn't know what she's talking about. This is ridiculous. But you know what? Verenice recommended her. I'm going to give her one more shot, and it's like you have to be so humble as a parent to step back and like take yourself out of the situation and really be able to take from like what this mental health professional is recommending. Like, let's just try it because everything I've done is not working. So, let me humble myself and like step out of who I am and who I think that I am and know that this is not, it's just outside of me, and just be able to take in that recommendation.
Sure. I mean, I think trusting the process is definitely something that's hard for all parents.
Yeah.
But also too, like you have as a parent, your own protective parts of you that come up.
Yeah.
When you hear anything that is inconsistent to what your own beliefs are.
Yes.
And so when these come up, they automatically build a wall between you. And so like you said, it's like, it's a humbling experience.
Yes. Like you have to question your belief system.
Yes.
It's really hard.
Fun. It's really hard as an adult because you're like, I am this old already. Like I should not be like, like a college student right now trying to figure out who I am. No, I totally get that. I think that's it. And it is I mean, as a parent, when I became a parent, that was the most humbling experience for me as a therapist. And I remember being like, what did I recommend? As a 22-year-old to what parent? Like, you become so humbled and you're like, that was ridiculous and definitely not something that family was going to be able to do. So life is nothing but humbling experiences.
Parenting is the most humbling experience I've ever had in my life. Oh my God.
Can be.
I always say this to everyone who doesn't have a kid. I'm like, you're the perfect parent until you become a parent.
Yeah.
And it's just, it's very, very humbling.
Yeah, I think I feel like I've heard you say that a few times already.
Yes.
We were like, you're the perfect. I'm like, that's true. Theoretically, you have so many ideas, and then it
Yes.
happens, and you're like, oh snap, things aren't going the way that
Yeah, absolutely.
they should be going.
I do like how I feel like more parents are. So when a parent is taking their child to a private therapist, psychologist, I feel like they're a little bit more invested in the process. And you know what? My kid does have something going on. We need to try and fix it. They're a little bit more involved.
Yeah.
What I see, and maybe you saw this too in the schools, I don't feel like they're that invested when it comes to like therapy or counseling in the schools. I feel like that's a big component, like the parent communication and training within the schools. It's, oh, you're having this problem with my kid, you work on it. I try to, and really, you know, it's just like, I don't know, I kind of struggle. Like, I feel like there just needs to be a little bit more parent training or accountability or recommendations from the school to the parents. But then we're also like legally like liable on certain things that we can say.
It can get
right?
political really quick, for
Yes.
sure.
Yes. But that's what I feel like I appreciate about the private, you know, private psychology,
Yeah.
like the private therapy, because you can give that firm input and recommendation to the parent, you know, and that training. And the schools were very limited on what we can do.
Yes, absolutely. I think one of the reasons that I went into private practice, well, not only to be able to find a work-life balance for my family, but also because I was able to work with families. And I think that's when I experienced and I was able to see the most growth for a child or a teenager, was when I was able to kind of connect with the families.
Yeah.
I was able to see it with my young adults. And them being college age, I would say about maybe half of them provide some sort of consent for me to speak to parent.
Oh, okay.
So that's, I feel like it's a lot.
Yeah, that is.
Given the understanding that once you turn 18, you're the right to, you know, be private.
Yeah.
But it is slower work than when I cannot work, because I am only working with one side of the individual, you know, with the system, I guess I should say, one side of the
okay.
system.
I
When
see.
sometimes they'll come in and they're at that age where they're beginning to recognize and have awareness of how family patterns may have affected currently, like either their emotional adjustment or their future plans or whatever that may look like. And when it's only one, there's a lot slower growth that
I
we
didn't
can
think about
have
that.
in
Yeah.
a session or in our time working together.
Yeah, I didn't think about that, because in the schools you can also talk to the teachers about their generalization and how they're working with peers or academics.
Right.
Yeah, I didn't think of that aspect.
It's a shift.
Yeah. So there's pros and cons to that, I guess. Now, okay, so I think we already talked about when families should seek help. Now, this is one that I struggle with too.
Okay.
So I feel
I can
like
help.
this interview is like for me than for anyone else.
Can you tell me what to do next?
I know.
I cannot.
So, what are some of the most popular coping strategies that you feel like are helpful to kids of any age? I guess we can just say school age, because most of our audience is school age parents. What do you find is like the most helpful coping skill for students that are struggling with anxiety? It has been identified. It is affecting either their developmental progress, their school, or their sleep, or the way their family dynamics are working. So now we've already established it's a problem, right? There is some type of anxiety going on. What are some general coping skills or strategies that you recommend initially to parents that are pretty general but really effective?
Yeah, well, let me unpack that question for a sec. When you say coping strategies, do you mean like when you see your child experiencing anxiety and you're trying to ground them? Or do you say, like, as a family, what are some of the coping strategies and direction that we can start off with to kind of change our perspective in helping?
I think the second part of it, because the first part of it, I feel like it's very commercialized, if you will. Deep breathing and all the meditation, right? When they're going through the anxiety, right? I think the second piece of it is what parents might need, like kind of the proactive approaches.
Right. So I think most importantly is to redefine anxiety. Anxiety is an emotion that we experience, and along with physiological symptoms that help us in survival in general. And so my place to first start as a family is, how do we view anxiety and how do we befriend anxiety? Where I think, like you said earlier in your reference, was that we are throwing this term around so quickly, like, oh, I have anxiety. Or, oh, I think I saw like a comedian say one time, it's like millennials tend to want to tell us what, as soon as you meet them, what their diagnosis is. And I think I don't remember what he said.
True.
He's like, I'm telling you my diagnosis. And then when you ask them what they're doing about it, they say, nothing. I'm telling you so that you can accommodate me. And so like, yes, I definitely feel that. Like we tend to have this idea now of like, okay, since you just told me you had depression or anxiety, or you're experiencing these symptoms, now I'm expected to accommodate you.
Right. Instead of you working and growing in that area, being aware of it.
Yeah.
Awareness is the first step to change.
Yes.
Yeah.
And I think sometimes that kind of thinking that has evolved over some time is that it doesn't allow us to see the humanity of our experiences with anxiety. And really my goal when I am working with families, when we see a heightened, so we're saying clinical anxiety, right? So we're not experiencing anxiety at normal levels, quote unquote, normal levels, where we're experiencing it way too much or way too intense, where it's interfering with their lives, then we have to change our perspective on that. And we're befriending anxiety now. So then it doesn't become more of we're viewing it through a lens of psychopathology, but we're viewing it as a human approach to anxiety.
I like that.
And so when we do that, we can almost empower our children, adults, young adults, adolescents, to be able to say, like, this is just part of me being a human. And then these are the things that I am going to continue to do despite anxiety, and anxiety can kind of come with me.
I like that. Instead of like, I have this disease,
Right.
and I'm going to have to live with it for the rest of my life.
Right.
Okay. I like that. I like that.
So
that is something that's not talked about a lot.
It's not, and I think it's more relatively of a newer approach. Not necessarily like within the last 5 years, but it started more of a reaction into understanding that anxiety helps us in so many ways. And when I start with the family, I always like show them this beautiful like bell curve where it's like on the, I'm going to get really mathematical here, but like on the x-axis, we have the level of anxiety one experiences. On the y-axis, we have your performance level. And so if you have low anxiety, you have low performance. If you have high anxiety, you have low performance. If you have medium anxiety, you have high performance. And so I show them this and I ask them, like, why do you think that is?
Yeah.
And it's funny, they all have an answer. They're all like, if you don't have any anxiety, then it means you don't care. They all say it, So it's like, they alone, each kid, each adolescent, each young adult, they know that if you don't have anxiety, it's because you really don't care about something. And so then they can kind of relate to anxiety in a different way.
Yeah.
And most of the time, then we can.
That's a good visual.
Yes.
Yeah.
And and we talk about like, we're in San Antonio. So it's like, why do the Spurs sometimes lose to really, really sucky teams?
Yeah.
And that's like because they go into that game thinking that they're not going to have to put up a fight and engage their physical abilities as much because they, quote unquote, are not as good.
Right.
And so I think when we use all of these comparisons into really changing the narrative about anxiety, then they can feel more like anxiety is for them rather than against them.
Yeah. I like that.
Yeah.
And not making it always the enemy.
No.
Yeah.
That's correct. And I think part of it too is also being curious about your relationship to anxiety. And, I won't get too much into detail because it's, there's a lot of details, but is once you can befriend your anxiety, then you're not so scared of it. And so you can begin to realize, and even small children can begin to feel curious about like, what is my response to anxiety? How can I find the courage to do what I love and then just bring anxiety with me? It's like the idea I've heard other psychologists say, like, if we're so scared of the monster underneath our bed, and you try to tell your son or your daughter, there is no monster underneath the bed, right?
Yeah.
And maybe a different approach would be comparable to what we're talking about would be, well, let's make friends with the monster underneath the bed.
Yeah.
And so it's a different idea and a different type of concept.
Yeah. It's a huge shift. I feel like it's a huge shift from the narrative that's out right now.
Right.
Yeah.
And I think that's very valuable too. I mean, we know that genetics can run in families. Right. It's very genetically driven. And so it's a huge shift if we can get the whole family to buy in into this idea. Then I think we tend to see a shift of not necessarily being trapped by anxiety, but living a fulfilling life.
Right. Yeah.
Despite these predispositions.
It can not only empower the child, but probably the parent has anxiety. A lot of the parent might have anxiety, right? And then so you're empowering the parent to work on their own anxiety by teaching them this concept as well. Yeah. And so can you give me a concrete example of what that might look like when you're working with a family? Like just maybe, I don't know, a hypothetical situation of like, what does that look like to befriend anxiety?
To befriend, I can give an example. I'm trying to think what would be the most concrete. So I'm thinking about a family that I'm working with, and their child is very, very talented, and physically. And so she's in a sport where she is that's the only time that she tends to experience anxiety is when she's about to conduct some sort of performance in her sport. And so she tends to freeze up during those moments. And then
just performance.
Right.
Okay.
Right. So when there is no performance, she's okay. There is some other mild symptoms of anxiety in other areas. But that's when it tends to, and affects her the most, because that is something that she's very talented, and the family knows that as well. And so they really want her to do well, but she doesn't want to engage in the sport anymore because she's exhausted, right? Fighting this anxiety, this heightened anxiety, I should say, that she feels every day. So we really kind of looked at and we became curious about, once we befriended that anxiety and we talked about how it helps her perform well during her performance. And we used all like the techniques that you just talked about that, there's a lot of resources and literature out there on. So we use visualization, we use deep breathing, we use attention-focused relaxation as well. And so when she comes up into that performance, one of the things that we realized for her, as she became curious about her own experience with anxiety, is that it's anticipation anxiety. And so it's not necessarily about the what ifs, right? Like, what if this happens during my performance? What if I create this error? It was more of like leading up to performance all that morning and even days before, it was so heavy for her to deal with that anxiety. And then once she began that performance, it went away. And so befriending the anxiety allowed her to be curious rather than avoid thinking about it.
Oh, okay.
Or rather than being trapped by it and being more aware. And so then when we began for her, like what that translated to was, okay, we're going to schedule your anxiety. We're going to schedule a time to worry about it. And this is when it's going to start. So an hour before performance. And then these are the things that we're going to do. And so that alone, it's like she's going to, like I talked about the bell curve, it's like she's going to bring anxiety with her, which she needs to perform well, because she's very talented, so there's a lot at stake here. She's bringing this in here. She's going to worry either way, so let's just worry for the last hour. And then if she worries about making an error, because sometimes that she does think, like, what if I make an error? If she makes an error, then we will worry about making an error when she makes that error. So then for her, it became scheduling. And then that
okay.
gave her that
Okay.
break that she needed from just preparing. She doesn't
Yeah.
need to feel anxiety about anxiety.
Okay.
You know?
Wow. Yeah,
Right.
that's really good.
So that's a very like easy translation, because it can
Yeah.
sometimes be very simple, like an easy translation of how
Yeah.
when we befriend anxiety and we know that it's for us and not against us, then we can understand our reaction to it.
So when she's allowed that scheduled anxiety, what does that look like for her? Like she just like sits there and thinks about it, or she journals it, or what is?
Well, if we're scheduling anxiety that 1 hour before, there's a lot of different things that can kind of occur with that. So her task is to visualize, right? Visualize her engaging in the performance, following through with what she needs to do. There's that deep breathing part. And then there's also that natural tendency that when you're about to be in a performance, everyone's pulling you in a million directions. So you're
Yeah.
not necessarily, your attention is focused on other things.
Yeah.
And so it just shortens that, and it gives her that break that she really needs, which is what she needed because she was ready to quit.
Right.
Right. She was
Okay.
like, I know I'm talented. I really like this. I hate the anxiety part. I can't deal with it anymore. And then when we began the strategy, she's like, I'm ready to go. Why?
Okay.
Well, that amount of intensity that she was experiencing that we now scheduled to 1 hour, she was experiencing for 3 days. So as you can imagine,
yeah.
like her arousal was so high end for 3 days.
Yeah. It's exhausting.
It's exhausting.
Yeah, that's very exhausting. I like that. Okay. And what were the parents' role in this? Did they support in any way? Was there something that they could have done to help, like, be proactive about it?
So every family is different. I'll answer your question of how I work with this family in particular. We definitely met a lot on making decisions for their daughter. Didn't know if, like, do we let her quit? Do we not let her quit? What's going to be beneficial? We do have a family history of anxiety, and we don't want to make the wrong choice where
Yeah.
10 years down the road she realizes,
Yeah.
I missed a whole year or 2 years, or I quit, where her. So I think where I'm thinking you're getting at, I'm trying to be on your wavelength, is that the family needed to know that there are times where she is looking into saying, please help me out of this anxiety, and I need you to state when there's no choice for me. Until she can do that for herself.
Yeah.
And so there are times like that, right? With young adults, we don't do that work because they are making their choices independently. But with younger children and adolescents, a lot of the time, what they are looking for when they reach for parent support is for parents to kind of lay down what's going to be the best choice. Because, and they were really concerned, I think, about we want to respect her beliefs and we want to respect her choices. And it's like, well, is this the anxiety talking? Or is this your daughter talking? And so it's funny for that one. We after I think we spent maybe 2 solid sessions on trying to figure out, and we're like, okay, we're going to let her take a break because she's just exhausted. We're going to let her be involved. And these are things that we drafted a plan of. These are things that she's going to be involved during her year off so that she can still have one foot in and come back to the sport. And then, and this is what our plan is. And so they're like, okay, we're all on board. We're going to let her take a year off. And then once we figured out that scheduling trick, she was like, I'm ready to try out.
Oh.
So she's the one that came and was like, I'm ready. So that's when we're like, oh.
It was really the anxiety
You
talking.
just needed to take a break and not have that be mentally draining on you.
Yeah.
Right? It's like when you have a presentation or a test, and it's like that's all you can think about is that test.
Yeah.
And once you take that test or once you do that presentation, you just feel so relaxed and you can truly take a break. So that's what she really needed, was just a moment where it's like, I can fully relax because I'm not going to do this for the next year.
Yeah.
And then she found the energy to do it when she was able to take that break. So then we figured out, this is what we need to do. We need to give you breaks. So I think that was the parent's role, was a lot of dialogue on how do we find the best decision? How do we make that best decision for your child? How can you support but not enable?
Right.
Which is
It's a
different
very
for
fine
everybody.
line. Yeah, it's a very fine line, supporting and enabling.
Right.
And
Tough.
that's very, very hard. Yeah. And I think, yeah, you just need, at that point, you do need like a mental health professional to be able to see outside of the situation.
Right.
Because like, what am I doing that's enabling this behavior? But I also want to support my child. Like where does that line, where are we drawing that line? Yeah, absolutely.
Right.
That was very helpful. Thanks.
I hope so.
It was. Motivational interviewing. You use this with your families?
I equip parents to use it with their children, especially their adolescents. I think they can be as young as 5 or 6, but really they get the most benefit when they're about 8 or 9, when their cognitive abilities have really developed enough to be able to understand not only what's occurring immediately, but understand the impact of their behavior into their future.
What does that look like?
So
What is
motivational
it?
interview, really the way I use it, I use kind of a combined approach of like using techniques from motivational interviewing. So like the types of questions that you would ask, like what is important to you? That might be like a motivational interviewing type of question in the most simplest form. And then I also use acceptance and commitment therapy. So value-based work. It's just a type of approach that looks at like, what does an individual value and how can we help them live a fulfilling life by understanding what they value.
Right.
So I use really a combined. And so when I teach my families to do that, the first thing I do before I even go there actually is to make sure that they have a good relationship, that there is connection and trust.
Yeah, that's the foundation before you
That's
can.
the foundation. Once they have that, so is asking questions. So that ask them about, what is it that anxiety, if we're talking, the realm of anxiety right now, is holding you back from? If you didn't have anxiety, what would your life look like? One of my favorite questions is stolen or borrowed from one of my favorite psychs, that he asked a question like to a parent is, he works with adults, but so I've kind of translated to children, but if you could get rid of all of your anxiety, but the caveat to that would be that you would not be able to understand what it feels like to have anxiety, and you couldn't relate to your own child, would you get rid of all of your anxiety? And so most of the time, parents will say no. And the same with children. So if I can get rid of because right there, that's what they do. It's like, I don't want to feel this anymore. I don't want to do this. I'm scared. Right? So if we can get rid of all that, the caveat is whatever is relevant to that child. So the caveat is that you will never get to enjoy let's speak dog phobia. You will never get to enjoy what it feels like to cuddle with a little puppy.
Yeah.
And to feel that connection and that warmth. Would you do it? And most of the time, they're like, no.
Yeah.
Right?
Yeah.
No. So it's using specific questions and to trying to frame it and bring the big picture into it in a way that doesn't feel so targeted.
It sounds like it brings back that curiosity about their anxiety.
Yes.
That's what it sounds like it's triggering. Some more curiosity and like problem solving and deeper thinking. Yeah.
So with that, sometimes too, what I tend to find out is if I see like individuals that tend to be a little more shy, more introverted, and then they experience anxiety, a lot of the time they actually do not know what their life would be like if they didn't feel held back by an intense level of anxiety. And so for the parents, that's when the motivational interviewing comes in. It's like, well, what do you think they would do if they weren't at home the whole time? And so then sometimes even the parents may not know. It's not that they're not connected, but it's just that, they took it as, well, that was just the personality. I thought that was just their personality.
Yeah.
Right? And sometimes they themselves haven't really been able to think about what it would look like for their own child or adolescent. And so we use these techniques to try to unpack what those values are, the things that they care about and the ways that they want to go. And to create more freedom in their lives.
Okay. Yeah, I really like that. I feel like this is just so different from the narrative that we hear so much on social media.
Take deep breaths. Make sure your belly moves in and out. And I mean, we do that. I mean, that's a no-brainer. That's what we do as psychologists, right? We're going to equip you with the coping skills, but those coping skills are going to look differently for everybody.
Right. Yeah.
One of the things sometimes, for those children, adolescents, or individuals that come from a background of anxiety where it's genetic, what I tend to find in my clinical work is that they don't even know what a feeling of relaxation is.
Oh.
So they don't know that sometimes they'll be in my office and they're kind of twitching, or they've got and you can see that they're experiencing a high level, their knees are shaking, and they're like almost just blinded that they don't and so then I have to start from the beginning. And we train.
It's almost scary to be relaxed.
Yes.
Because I don't know what this feeling is.
Right. Yeah. This feels uncomfortable. I should be active, or I should be. So we have to work on okay, let's be in touch with that relaxation. And then we start that, physiological state. We start there. And then we can kind of move into other types of work. So it is different in that, we're not just deep breathing. We're not just changing our thoughts, which we know doesn't work anymore.
Yeah.
So it is a different narrative about anxiety.
Yes. Thank you so much for sharing.
Yeah.
I took away a lot. I'm sure everyone else is going to take away a lot from this too. And I like the different perspective. There's so much more I wanted to touch on, so I'm going to have you come back later.
I'm here.
But we're going to wrap it up. So thank you so much for coming and sharing. I know that, like I said, anxiety is such a big topic right now. And I just wanted parents to also see what, the differences in what it could look like for private practice also versus, seeking out a private professional versus just requesting for school psychology to do counseling in the school. Sometimes students need both. Sometimes they need more of the private therapy. And so I like that you were able to bring that in so parents can hear and see what the difference looks like. They always hear from the school part of view or the school point of view. And so I think also you gave some really concrete examples and help to parents.
Good.
Good. So thank you for coming.
Yes, absolutely. Thank you.
Okay, all done.